a boy, son. So when we find out that I was expecting a girl, so we were so happy. I stayed with her for 4 days, and I still remember those 4 days, and I like to make them last forever. She was my little girl. She had a really bad night, and yeah, she was sleeping with me. I just saw something really weird. I said, I took her hand and just let it go. It went like this, and I said, Mom, something's wrong. They called 911. I just saw my baby laying on the bed, and I thought, is she okay? I said, I'm sorry.
Hi, my name is Alicia Martin Warren. My daughter that passed away is London Taylor. Her birthday was June 2nd, and she passed away June 27th. She was 25 days old when she passed away. Did our normal thing. Baby slept, fed her, put her in her swing, read to her, watched some TV. Later on that evening, we went to bed. Well, I was trying to put her to sleep, and I wasn't trying to fall asleep, but I ended up falling asleep with her. And she was on my chest. My brother came in to come check on me, like, sis, you're supposed to come back downstairs. And when he came in there, baby, she was on my chest, face to the side. Her nose was bleeding. He was like, baby's nose is bleeding. I'm like, what? So I get up. We try to do everything to wake her up. She wouldn't wake up. She was breathing, but she wouldn't open her eyes. So we rushed her to the emergency room. They worked on her. I thought it was something that I did wrong, because she would sleep with me. But I made them do an autopsy on her. They said it was SIDS.
If a baby is placed on their stomach to sleep, they may not be able to lift up their head to get air. Do not let your baby suffocate while sleeping. No sleeping on an adult bed. No sleeping with adults or other children. No sleeping on couches, sofas, or recliners. No sleeping with soft bedding or stuffed animals.
When I had London, I had bears all in her playpen and everything. No. I don't do no co-sleeping with her. She needs to sleep in her bed. My daughter passed away 11 years ago. I just now started getting my counseling, and I'm still doing it. So I'm just now getting to cope with it. It scares me, it freaks me out sometimes. Some nights I can't sleep, so the most I can do is make sure she's sleeping in her own bed and keep going to counseling.
Alone, back, and crib always.
I'm Jasmine Brosnan, and I am the Director of Collaboration and Impact at the Child Abuse Prevention Center. So the Child Death Review Team in Sacramento is a team made up of voluntary members who come from all different areas of expertise, whether that's the hospital system, our coroner's office, law enforcement, or even our public health department or some of our local agencies. And we meet each month, and we review anywhere from, I would say, 4 to 6 infant cases every month.
Every other week in Sacramento County, a baby passes away in their sleep. In Sacramento County, half of the babies that die while sleeping are African American. Yet, we only make up 13% of the baby population in Sacramento County.
Something that we see a lot of, unfortunately, is a lot of co-sleeping in adult beds. That can be co-sleeping with parents or children or other caregivers, or even just placing an infant in an adult bed. But that's something that happens frequently, and is something that we just continue to see over time. We know a lot about stories with exhaustion, or stories of just needing to rest while you're feeding. And as long as you have a plan for where to safely sleep an infant, and you keep that practice in motion, it's a lot easier when you are exhausted to continue that practice. Opportunities for education in general have always been lacking with our systemic racism and generational trauma. Needing to access those resources can be really challenging and be a difficult step for some families to take, even when they do have the opportunity.
The major environmental risks associated with infant sleep-related death is baby sleeping with other people, including both adults or other children, sleeping in a non-infant bed, like an adult bed or couch, or the baby sleeping on their side or stomach. Alone, back, and crib always.
So if that means bringing a crib into the bed with you, or into the bedroom with you, if that means room sharing, that's fine. It's the bed sharing component that puts you both at risk. And the whole purpose of the Child Death Review Team really is to develop prevention that works. We don't want to ever see those deaths happen again. And so even though it's incredibly difficult to sit in a room and talk about some of the most horrific circumstances that a family can go through, we all get through that knowing that on the other side of that are prevention materials and tools and resources and education that can hopefully prevent that from happening to the next kid.
Yes, my name is Gregory King. The name of my organization is Always Knocking Incorporation. My organization is a multi-level communication rehabilitation program that focuses on the entire family, providing full wraparound services, whether it's mental health, whether it's parenting, whether it's anger management, whether it's positive decision making. I have witnessed someone who has lost a child to SIDS. And it's such a sad situation because it could have been prevented. It have affected me in a way that it's important that I do my part in educating the fathers, the mothers, whoever I can educate, in how to be more safer and get them to understand what SIDS is, sudden infant death syndrome, with our babies. And it has such a huge impact on me that I know that I had to get involved with this so that I could put that information out into the community, and also giving the fathers who have lost these kids a safe place to come. Being a father and a grandfather myself, for so long now, this information has not gotten into the black community the way it need to. It's so high right now that we must do all that we can to reduce that. Thank God that as you has raised your babies that way in the past, but we want to make sure that we educate you and others on the fact that those kind of things can and will happen. As a provider, as a director, I must do my part to stay boots on the ground and put this information out to the community and let our people know that there is resources to help you to understand that Safe Sleep program is vital and is very important to help saving lives in our community.
Alone, back, and crib always. In 2022, 1,677 African American babies were born in Sacramento County. Out of that number of babies being born, 22 babies passed away. Per 1,000 births, African Americans make up about 13.1% of the deaths.
African American babies are dying 3.8 times more than any other race in Sacramento County.
Some of the things I didn't know, a safe crib is one that has no blankets, no stuffed animals, except for a tightly fitted sheet. I understand how you may think that it's kind of not realistic, but it is something real, and it can happen in any instance. So no, don't let them sleep right next to you for a little bit on the couch while you're doing something. No, don't let them sleep on the bed with you, because you don't know what's going to happen when you're also passed out. There's lots of things that you think you can control, but at the end of the day, there's so much more that you can't, and accidents happen all the time, and you just don't want that to be the accident that happens. I have a 1-year-old and a 2-year-old now, and it's always just the better choice now is to just put them in the crib on their back with nothing else. It's safe, and I'm thankful I did it. It made it easier for me, honestly. It seems like a hassle when you're going through the education and learning all these things and what feels like rules and stipulations, but when you put it into practice, it's actually not that hard.
I have one beautiful son. I was not aware that it wasn't a good thing to sleep with my baby as much as I wanted to. I wanted to make sure that I had a safe and reliable bassinet for the baby. And I do understand that in the black families, or just in families in general, where the elders do things one way and they say, hey, you know, it would be fine, you know, you survived, and you know, if I was prepared to just let them know that I'd rather be safe than sorry. Thank you, Safe Sleep Baby, for informing me. My baby is well and healthy. He's 1 year old right now and he's doing great. So thank you.